The same applies in terms of a partnership between the National Heart, Lung, and Blood Institute, which is part of NIH here in the US, NHLBI as we call it, who is a co-sponsor with CDC for the National Asthma Education Program and guidelines that CDC supports in communities. So we are essentially newcomers to the self-management arena. Having said that, I mean, I do think that's important context. So we don't have the data, obviously, to show even what good or what uptake is beyond our pilot studies. We don't have robust data to show what how uptake is going in the US compared to these other conditions. What I can tell you, though, based on what we do know regarding at least diabetes and asthma, is that about 1 out of 2 people with diabetes who are recommended to participate in a self-management program participate. So not great, clearly, but not surprising. And I would venture to say that it's probably about the same for asthma, although probably a little bit higher for pediatric asthma. So again, as I have shared, we are seeing relatively low uptake, even in our new programs and communities. And that is a problem. I mean, it's an unfortunate problem because, as I said, it's hard to continue for us, to go back to our to Congress to justify funding this type of work if we're just not reaching, if we're not effectively reaching people in the ways that we'd like to reach them.
Can I be controversial and suggest that one of the issues might be that, unlike diabetes and unlike asthma, epilepsy is stigmatizing, and that might be one of the reasons that people don't want to participate, is because they still have difficulties coming to terms with their own condition.
I think Gus and others certainly might weigh in. I think that's plausible on the one hand. I would say on the other hand, we, at least in our own efforts, we're very mindful of stigma as a barrier to participation, as well as transportation restrictions, frankly, especially in the US. I mean, given, unlike many parts of Europe and elsewhere, we don't have good public transportation, certainly in our rural states and communities. So that is why even 20 years ago, when we started this work, we decided to create programs that were delivered by phone. So that, again, at least we're eliminating potentially or limiting that barrier in terms of stigma. Someone can just call up in the privacy and comfort of their home. So I guess I'm not 100% sold. It's, that stigma is a barrier. I would still attribute it to lack of awareness, lack of understanding of the benefits of self-management, and lack of provider recommendations for participation.
So I just one point, and I'll come over to Liam about that specifically. So why aren't doctors recommending self-management programs?
In the US? I would say from our experience talking with some providers, and no doubt as many of you know from your own experiences, many providers are, they are sold, or they don't even have to be sold. They get it. They see the potential benefits, and others simply want more evidence, and they're not sold. That's been my experience in a nutshell.
Thank you, Rosemarie. Liam, any thoughts about this discussion at the moment from your experience?
Yeah, well, I'm really interested. So, I think what Nuran said earlier about resources is key, but I think that's a complex thing. It took, even in a resource-rich country like the UK, where we, the context is that we have a national health system, so we've got a kind of universal healthcare coverage that with, you have epilepsy nurses in most